broadcast is now starting. All attendees are in listen-only mode.
Hello everyone, this is Ian Potempa, and I would like to welcome you to today's presentation, which is part of a series of webinars provided by the Division of Public Health, Section of Chronic Disease Prevention and Health Promotion. The primary aspects of our work include health promotion, chronic disease and injury prevention, and data collection and surveillance. This webinar series was created to provide a way for us to talk about our projects and explore how we can work together. We will be offering these webinars on the third Tuesday of every other month at 1 p.m. Today's webinar was postponed a week so it would not conflict with the Public Health Summit. There are a few housekeeping items to go over before we start. If you are listening by phone, please keep it on mute. Please do not put this call on hold. If you receive a call, please hang up and call back in. The webinar is planned for 30 minutes, a 20-minute presentation, followed by 10 minutes of questions and answers. A recording of today's webinar will be sent to all participants and the slides will be made available within the week. Audio will come through your computer. You can also use the call number provided. If you need help listening to or watching this webinar, please let us know. To ask a question, you will need a microphone or you will need to call into the number provided. Please hold questions until the end of the presentation. Today, Julia Thorsness and Azela Ford will talk about increasing preventive screenings for colorectal cancer. Thank you for presenting today's webinar.
Hello, everyone. My name is Azela Ford. I'm a student at the Loma Linda University School of Public Health. And today our initiative is to increase colon cancer screening or colorectal cancer screening in Alaska. Our presentation today will discuss the impact of colorectal cancer in Alaska, barriers and strategies to increase screenings. Colorectal cancer is the third leading cause of cancer death in Alaska and also the fourth most commonly diagnosed cancer in Alaska. Our screening rate of colorectal cancer in Alaska is about 66%. The initiative is to attain a population screening of 80%. Reaching those categorized in the unscreened population is likely to increase the screening rate. The graphic shows an illustration of testing status. We have 65% that has been tested and up to date for the colorectal screening. We have another 7% that has been tested and it's not up to date. And then we have a 28% that has never been tested. Of the 28%, we have 76% that are insured, never got tested, and also a 24% that are uninsured. Yet, even while we know colorectal cancer screening is important, many of us are not getting screened. So as I previously said, today we are going to address the barriers that exist for both the insured and uninsured. We have done worried well who does not recognize screening as important. With us finding new ways to communicate and different strategies that will engage this population, it is likely to increase our screening rates. Here we have some of the barriers with the results that was taken from our focus group that was conducted here in Alaska, May of 2017. I heard the preparation for the test was unpleasant. I did not have any symptoms. I have no family history of colorectal cancer. The cancer screening cost is too much, or other. And other can involve or be related to fear, lack of knowledge, or no physician recommendation. This screen speaks about our messengers that the population will generally trust about giving information for screening that will help to encourage screening. The y-axis is the rating score, and it scores from 0 to 4. Looking at the results, medical provider scores the highest with about a 3.8. Then we have family, and we also have the government that also scores about a 3.0. So those are the top 3 messengers that generally has an impact on the population, who they will trust in reference to being screened. We also have with us today several messages, 1 through 7, that was presented in the 2016 Communications Guidebook, 80% by 2018. And these are the messages that we tested with our focus group in May of 2017 here in Anchorage and also in Wasilla. Message 1, the key point in message 1 is, as we look at the several screening option, and with that we are actually addressing an audience that will speak of affordability, being able to be prepared and also take the responsibility of their health. We look at message 2, which is colorectal cancer is the second leading cause of cancer death in the U.S. when men and women are combined, yet it can be prevented when detected at an early stage. And with this message in educating the population of the people about the facts can actually encourage them to want to stay in good health. We look at message 3, preventing colon cancer or finding it early doesn't have to be expensive. There are simple, affordable tests available. Get screened, call your doctor today. Here we are addressing affordability, helps to motivate the financially challenged and also the uninsured. Message 4, most insurance plans cover life-saving preventive tests. Use your health benefits to get screened. And here we are addressing the access to service and also addressing affordability as well. As we look at message 5, it says, many people with colon cancer do not have any symptoms or family history, which is why screening is so important even when you feel healthy. Get screened. Call your doctor today. And message 5, we are addressing the misconception or the myth that having no symptoms means I don't have colorectal cancer. Message 6, if you are 50 years or older, get screened for yourself and the ones you love. Don't take unnecessary risk and miss the moments in life that matter. And here the individual is taking preventive measures to protect themselves and as well as their loved ones. And we look at message 7, nearly 2/3 of adults 50 and older are getting tested for colon cancer. Join the national movement to increase colon cancer screening rates to 80% by 2018. And given the facts about screening may motivate the action desired, and which is to increase screening among the population of the uninsured and financially challenged. We also put the messages to test in our focus group that we did in Alaska to see which messages will best reach the population that we're seeking to have screened. And looking at the results that we have here, message 5, message 1, and message 2 were those messages that was rated the highest. And those are the messages that we will use to try and reach the unworried well population. The recommended messages are on the screen, which is message 1. There are several screening options available, including simple take-home options. Talk to your doctor about getting screened, and that's addressing affordability. We also have message 5, addressing the myth that having no symptoms means I don't have colorectal cancer. And we have message 2, colorectal cancer is the second leading cause of cancer death in the U.S. when men and women are combined, yet it can be prevented when detected at an early stage. And educating people about the facts can encourage them to want to stay in good health. Here we have a personal testimony and a doctor's message. Our focus group conducted in 2017 presented results with the messages that will best reach the unscreened. Messages combined will serve as a strategy to reach the unscreened population. And hearing about someone else's screening experience is a way to give encouragement and reassurance that the test or procedure is not as bad as it seems. It is also sending a message of why it is important to get screened.
I was not overweight. I've always been an athlete, a swimmer, a biker. No colon cancer in my family that I was aware of. I was diagnosed with colon cancer. It's a very treatable and very beatable disease. It just makes total sense to have that screening.
Just like Larry, there are many people who are healthy, do not have clear symptoms, and do not have a family history of colorectal cancer, which is why screening is so important. Talk to your doctor today to find which option is best for you.
And screening saves lives. So this is our presentation today, and these are the messages that we will use to reach the population of the unscreened. And hopefully we will increase our screening rate. Thank you.
So here's more contact information for Asla and Julia Thorsness, who oversees the comprehensive cancer program for the state. Both of them are here today. If you have any questions, they can answer those right now for you. So please type them in or raise your hand, and we can answer your questions. While we're waiting for questions to come in, can either of you talk about how you're going to be using this public service announcement?
Sure, I'd be happy to. This is Julia Thorsness. We're really excited to be able to have funding from our CDC grant. So the Center for Disease Control contributes to our program, and they have approved use of their funding to do placement. So you'll start seeing this PSA on television starting the first full week of March, and it will be running through the end of March. And we hope that it will be received well. It was received well by our partners, and we think that it will make hopefully a big impact. So if anyone hopefully will see that, but if they would like to use it in another way, you're welcome to contact me if there might be another opportunity for placement.
Let us know if you have any other questions. As a reminder, these slides and the webinar will be posted online to our webinar website within the next week, and we'll send out an email when that is there.
There's one here.
Do you want to just read it?
Sure. It says, great presentation. Does it discuss all screening options? Also, our PowerPoints available to download. They will be.
So the PowerPoint will be available within the next week, and you will get an email when it is up there.
So the messages that were highlighted, absolutely. I think knowing that there's more than one option beyond the colonoscopy for screening is really important. Because for some people, they will never be accepting colonoscopy as a screening modality, but there are other options, and we want to make sure that that information is out there. It's not specifically called out in this PSA, but in terms of education for providers, education for health insurers and employers, that is a part of those types of presentations. And you're exactly right, it's an important piece, knowing that there are options and being able to talk with your own provider about which is the best choice for you.
All right, if there's no other questions, we're going to conclude this webinar, and we will again share it with you all in the coming week. Thank you so much for your time.